who had breast cancer in the past and was being treated with endocrine medications, and she gained significant weight.
Sorry
And
to
she could not.
interrupt.
Weight gain is a very common side effect with tamoxifen therapy after breast cancer. Surgery patients, they are usually put on tamoxifen or aloxafen, who are breast cancer survivors for long term for prevention of recurrence. So one of the side effects tamoxifen has is it causes excessive weight gain. And in addition to patients who have comorbidities such as diabetes, hypertension, dyslipidemia, and any metabolic syndrome, it causes fatty redistribution in the body, and it causes significant weight gain. So the topic of this presentation is how GLP-1 agonists can help modify patients lose their weight, who are breast cancer patients, post-breast cancer patients treated with lumpectomy and are on tamoxifen therapy. So for the case review, our patient was a 60 years old female whose chief complaint was she had gained 80 pounds over 4 years. And she has had breast cancer lumpectomy followed by radiotherapy on left side, and she was on tamoxifen for last 5 years. So before her diagnosis of breast cancer, her weight was 219 pounds. After she was put on tamoxifen, her weight increased to 290 pounds. And 6 months ago, she was started on liraglutide, and her weight decreased to 258 pounds, which is approximately, she lost 32 pounds in 6 months. The dosage of liraglutide was 1.8 milligrams, and she had a new complaint that she had right arm lymphedema. So for past medical history, she had diabetes, hypertension, hyperlipidemia. And for surgical history, this was not her only breast cancer. She had a recurrence in the same breast into 2021, and before that, she had one episode before that in 2020 for the same breast. So she was given like 6 weeks of radiotherapy and was started on tamoxifen. So her family history was significant for breast cancer in her sister, in her disease, which was deceased 21 years ago. So there is a possibility that there is some genetic component to her subtype of cancer. But we did genetic testing, and her estrogen receptor was negative, her HER2/neu was negative. There were no significant genetic factors modifiable for this patient. So she does not smoke, she does not drink, or she does not use illicit drugs. So she was very compliant with her health. She was very educated. Uses, she goes to her annual screens, her annual physical exams. Her DEXA scan was non-contributory. Her pap smear was non-contributory. Her mammogram every 2 years was non-contributory until the diagnosis of breast cancer. So for other medications, she was on tamoxifen, as I mentioned. She was on metformin for diabetes, lisinopril for hypertension, and pravastatin 20 for hyperlipidemia. And she was started on liraglutide 1.8 milligrams daily. So how tamoxifen causes weight gain is the question, and literature says that it causes altered fat distribution and slows metabolism, leading to weight gain. And it can cause patient to accumulate fat, and it is very difficult to lose. So the patient in our case reports that she was excessively fasting and at least walking 1.5 hours daily for past 2.5 years, and she was unable to shed even more than 10 pounds. So there was no way she could lose her weight, including dietary modification and lifestyle modifications. So she says she goes to gym. In addition to that, she goes 1.5 hour walking or running, and she also does not use any carbonated diet or stuff like that. And she was unable to lose her weight. Uh, so the question is, nowadays we have GLP agonists, which are very common, liraglutide, semaglutide, and tirzepatide. So their mechanism of action, I will just briefly go over them. I think most of us know about it. GLP agonists cause increased insulin secretion, decreased glucagon. It suppresses appetite and increases, it promotes weight loss. So it was FDA approved in USA for type 2 diabetes mellitus with A1C more than 9. If you have BMI more than 30, or if you have BMI more than 27 with any additional comorbid factor. Um, and polycystic ovarian syndrome. So as of now, FDA has not approved GLP-1 agonists for any other indications, including patients such as ours. So in liraglutide, literature says that it reduces body weight up to 10% annually, and it is effective in managing diabetes, obesity, and polycystic ovarian syndrome. So there was one scale trial which shows that patients were treated with liraglutide versus placebo on a dosage of 3.0 milligrams daily, in addition to diet and exercise, and it was seen that they lose up to 10% of their body weight in 6 months, and 14 to 15% of the body weight in up to 12 months. So, as I mentioned, this is the same repetition slide for diabetes, obesity, polycystic ovarian syndrome, hypertension, and dyslipidemia. So the question is why liraglutide? So in US, it is very complicated to get approval for medications which are not indicated, such as our patient. For her, ideal thing would be to use once weekly injection, but her insurance was not covering it, and she was not also very comfortable using injections. She also does not use insulin. I mean, she does not use insulin. She does not require insulin, but she is very wary of needles. So she preferred oral tablets. Liraglutide is once daily tablet, and it is a sustainable option for weight loss in patients in which other methods have not worked, such as our patient in which lifestyle and dietary modifications have not helped. So, patient with overweight, they have a greater risk of developing recurrence of breast cancer. So the important factor for such patients is to control their weight, because studies have shown that um, recurrence of breast cancer risk goes up if their BMI is high. So the study is hazard ratio shows it is 1.1 with confidence interval 0.97 to 1.24. Um, there was one also study which shows BMI changes at 12 months for GLP-1 agonist in breast cancer patients versus general population. This was done in Solon Kettering Hospital in New York. It was a retrospective cohort study in which patients were being treated with um, uh, uh, anastrozole or tamoxifen or loxapine in combination with GLP-1 medications. So the problem with this study is they did not specify which GLP-1 medications they were using, and there was also it is also a single institute study. It is not multi-institutional study. So the study primarily evaluates mean baseline BMI and proportion of patients with BMI more than 30 and change in their BMI after 12 months. So this is the data. As you can see, for the blue bars are the general population, and the orange bars are patients with breast cancer who were treated with tamoxifen and were put on GLP-1 agonists. So there is one point to notice that tirzepatide does not decrease weight in such patients. It increased weight in such patients by approximately 2.3 to 2.4%. Among other options, we have semaglutide, liraglutide, and dulaglutide decrease weight, but it does not decrease weight as much as it does in general population. So it means that history of breast cancer and tamoxifen do have some role to play in terms of how GLP-1 agonist in helping patients lose the weight. We can see that liraglutide shows a 3.51% decrease, and dulaglutide leads to 2.33% decrease, and GLP-1 agents on a whole decrease 3 to 5 times lower weight as compared to a general population. So the study concludes that breast cancer patients on endocrine therapy exhibit less significant weight loss, as I already mentioned, with GLP-1 medications in comparison to general population. So the limitation for this data is that there has not been much studies done on patients with this specific population who are being treated with tamoxifen or aloxifene and post endocrine therapy when they gain weight. How do GLP-1 agonists? There are not enough randomized control trials there are very few studies, and there are also observational studies. So there is definitely need for further research in this avenue. So this case shows that liraglutide was well tolerated in patients. There were no significant side effects. Now, approximately 1 year has passed since patient is using this medication. So the data I mentioned was approximately 4 to 5 months old. And it is important to screen cancer patients who might be candidates for these GLP-1 agonists. So general safety and profile includes side effects of these medications, which includes nausea, vomiting, GERD. In very rare and severe cases, it can also cause pancreatitis, but it is very rare. So the limitations, as I mentioned, it limits generalizability. There are there is lacking evidence in patients with long-term cancer survivor of how they lose weight, and future research needs to be done with this specific subgroup of population, because as of now, I can say about US, it is being studied in a lot of populations, but it is only FDA approved for only 4 indications. And even if you have a BMI of 29.8, insurance does not cover GLP-1. So concluding my presentation, I would say liraglutide shows promising results in reversing tamoxifen-associated weight gain in breast cancer survivors. Um, GLP-1 agonists may mitigate endocrine therapy weight gain. It is again a case report, but causal association cannot be established until there are randomized control trials. And dosage should be tailored according to patient needs. So the retrospective study I mentioned, it used 3.0 milligrams of liraglutide, but our patient was responding on 1.8 milligrams, so we did not see any point of increasing the dosage. So the dosage of medication should be tailored to your patient needs. And GLP-1 receptor agonist receptor an effective option when lifestyle changes fail. And I would like to thank the Women Health Institute, Rutgers, New Jersey, for giving me this opportunity to present this case.